Now I'd like to give a warm welcome to pediatric neurologist, epilepsy advocate, parent, patient, and author, Dr. Kristen Seaborg, who's joining tonight from her home in Wisconsin. Thank you so much for joining us, Kristen, and please take it away.
All right, great. Thank you guys so much for having me. I'm really, really thrilled to be here. I'm a little disappointed that we couldn't do this in person last year, but as it were, the whole entire world has turned upside down. So here we are. So today I'd like to talk to you about what I have at times called the silent epidemic or the sacred disease. There's history rooted in both of those, but I should clarify, I think the term the silent epidemic was more appropriate before there was a giant pandemic and we all thought of diseases or illnesses in a different way. So moving ahead, if I can share or advanced, here we go. We got it. So first of all, I know I'm preaching to the choir. I know you guys are here because you have an interest in epilepsy, but let me just, so we can all frame our thinking together or that we're on the same page. You guys know epilepsy is extraordinarily common, although it's not as widely talked about as perhaps it should be. So epilepsy affects 65 million people worldwide. That's the most recent statistic that I could find, including 260,000 Canadians. And 35 million Americans. Roughly 1 in 100 people right now are living with epilepsy. And of all the people living with epilepsy, up to 30% of these patients are not able to have their seizures controlled with 1 or 2 medications or more. This is a world map just to kind of drive home the point that epilepsy is a global problem. This was published in Lancet Neurology just in 2019. An assessment of the global burden of disease across the country. It was done by review of multiple medical literature papers. And I think this map illustrates a couple things. First of all, even the countries with the lowest incidence of epilepsy have an incidence of 130 to 180 per 100,000, which is fairly high for any common disorder. That being said, other parts of the world without as much industrialized or sophisticated healthcare, the incidence of epilepsy is much higher. Up to 700 people per 100,000 are affected with epilepsy. So it's incredibly common. And as you know, it affects many aspects of our life, not just seizures and medications. This is a graph that I borrowed from cureepilepsy.org, but I found it in multiple places just to illustrate 2 things about epilepsy. First of all, the incidence of epilepsy is most common. It's in kind of a bimodal distribution, most common in children under the age of 2 or in elderly adults. The second thing that this graph shows, though, which I think is important to pay attention to, is these are now it's old dates, but over the last 100 years, the incidence of epilepsy has increased, particularly in the elderly population. This could be there for a variety of reasons, including that we know how to diagnose epilepsy more. Our population on the whole is getting older. But that being said, epilepsy is incredibly common in people of all ages, nationalities, and backgrounds. So as I'm sure you guys all know as well, what you see with epilepsy, if you are the patient or the family member of the loved one or the loved one, a person with epilepsy, is really what we see is the tip of the iceberg, right? There's plenty of other things that go along with epilepsy that aren't just what's immediately obvious to those of us that live near it. Just some things that are part of the iceberg. 1/3 of people with epilepsy can experience anxiety or depression. It's the most common comorbidity in people living with epilepsy. And then just some kind of scary but worrisome statistics. Patients with epilepsy are 15 to 20 times more likely to drown. They're 22% more likely to die by suicide. SUDEP, or sudden unexpected death in epilepsy, occurs. It's a rare condition, but it still occurs in over 1 out of 100 patients with epilepsy. Pregnant women with epilepsy have a roughly 20% chance of having more seizures during pregnancy. And as I mentioned before, 30% of people, roughly 30% of people with epilepsy continue to have seizures despite appropriate treatment with anti-seizure medications. So if epilepsy is this common in everywhere, why don't we talk about it more? Why do you and I have to get in these advocacy groups and think about how we can educate the public about epilepsy? To be honest, I don't know the full answer, but I do have a few theories or thoughts. Yeah, so if you look back at historically epilepsy, how it's been documented through the ages, the history of epilepsy is rooted in stigma and misunderstanding. So as ancient as 2000 BC in the Babylonian Empire, this is a tablet where scribes actually wrote about all of the seizure types that we know that exist today. So super interesting. They described all the different seizures, but then associated with each different seizure type was a spirit, an evil spirit or god that was believed to have cursed the patient, and that was the cause of their seizures. So beginning in ancient times, epilepsy was thought to be a curse as opposed to a true medical illness. Moving forward in time, Hippocrates, who's considered the father of modern medicine, actually coined the term seleniatizae because he thought that people with epilepsy were affected by the moon or the moon cycle. So we noticed that in particularly some people, epilepsy or seizures tended to occur in a cyclical nature. Interestingly, this term was the very early version of lunatic, which we now use in a really derogatory sense to describe people who are affected by mental illness. Hippocrates, although some of his terminology was questionable, he actually was quite ahead for his time. He was the first person to think of epilepsy as actually a physiologic illness that was rooted in something that was truly different about the body, as opposed to being evil curse or a punishment for sinners. Furthermore, though, he recommended early epilepsy surgery. Thank goodness I wasn't alive at this time. He recommended you poke the opposite side of the head that wasn't affected by seizures and let out the phlegm. These are the rudimentary tools or replica of what he was using at the time. Again, moving forward in time, in the 1500s or 1494, in the Salem witch trials, two Dominican friars published a handbook that was describing how to find a witch. And they said that the way to identify a female witch were the people that were having seizures. So subsequently, many women living around this time who were living with epilepsy were actually identified as witches and hung as a result of their illness. So you guys might be thinking, all right, this was prehistory. We've learned a lot and things aren't like that anymore. But unfortunately, as recently as the 1920s in Nazi Germany, people with epilepsy were had forced sterilization so they wouldn't reproduce. And in the US in 1956, as recently as the 1950s, patients with epilepsy were forbidden to marry in the United States. And this is a quote, I won't read it all to you, but from a German neurologist talking about the epileptic patient and how they really have no joy, no ability to succeed in life because they have epilepsy. So this has been a long, long history of reasons why people with epilepsy have struggled in the community, I think. And while we've moved forward from here, I feel like some of the stigma really does still remain and some of this misunderstanding. So you guys might be wondering, or maybe you don't because you read the thing before, but why should I care? So if you Googled me on the internet or you saw me in the neighborhood, this is what I would hope that you might find. So I'm happily married. I have 3 adorable children, 2 beautiful dogs. You might also find that I've recently completed training and now I'm a certified child neurologist. But what you might not find right away or know, this is last month in the epilepsy monitoring unit, how I continue to live with seizures. And it's been a kind of lifelong thing for me and something that I've learned to live with, but continue to fight with. And that's why I've cared. So my history with epilepsy begins when I was a toddler. When I was 18 months old, I had a really bad case of influenza. And as my temperature rose, my body succumbed to my first and most devastating seizure. Seizures with fevers usually are short and benign, but mine took a more ominous course. Seconds split onto minutes, which led to almost an hour of unrelenting seizing. At least 45 minutes to an hour was what they estimate. Eventually, doctors were able to stop my seizure and place me in medically induced coma. But the theory is that during that first prolonged seizure, the blood flow to the deep parts of my brain, specifically my right medial temporal lobe, stopped, and then a scar formed that would remain for the rest of my life. I was in the hospital for 2 weeks after that first seizure, first getting out of medically induced coma, and then later for treatment of that really bad influenza. And as I was discharged, the doctor actually warned my mom that maybe this won't be the end of my seizures. Because that first event was so severe, I was placed on phenobarbital, which I took every day till I was 5. Well, most kids hate taking medications. I actually really loved it. My parents would put the phenobarbital in a spoonful of applesauce or ice cream. And after dinner every day, I got to have my treat. My brothers didn't get to have a treat. So I actually thought it was kind of cool. Finally, when I was 5, I had an EEG, which was normal. So I was weaned off the phenobarbital. And my parents and I tucked epilepsy away in that group of unwanted things that you hope to never come back to. I had a really blissful childhood in Wisconsin. I just had to worry about if I had enough hairspray for school that day or enough fluorescent clothes. But really, epilepsy was a distant memory until I was 14 years old. So when I was 14, I was at an amusement park with some of my girlfriends, and we were walking from one roller coaster to the next. And I remember as I was walking from the roller coaster to the other, I had this sudden overwhelming sense of deja vu. It felt like everything I was seeing, I had seen before, and I couldn't quite place it, or I couldn't quite understand it. Well, I paused to think about this unusual sensation. I suddenly felt really uncomfortable. My stomach was uncomfortable, and then I felt hot. And then I was repetitively swallowing, kind of beyond my control. My friend who was ahead of me looked back and she said, "Kristen, what are you doing? And what's that thing you're doing with your face?" Because I was actually smacking my lips. And just as she figured out what was going on, or that I was acting a little unusual, the event started to abate, and I joined her and I went on with the rest of my day. So the next day I was trying to explain this spell to my parents, and the best I could explain is I felt weird and hot, and I had this funny stomach thing. So they took me to see the doctor to figure out what was going on. So I remember sitting in the pediatrician's office the next day and trying to explain this again to him. And again, I kind of used the words, I felt hot and I was swallowing and my stomach felt funny. And so he focused on the stomach and he beckoned me to the exam table. And my dad was in the room at the time. I was a 14-year-old pubertal female. And he did an abdominal exam, lifted up my shirt, squashed my stomach. And then he turned me to the side and did a rectal exam and took a stool sample while Dad was sitting in the room. He diagnosed me with reflux. He told me to take some Mylanta if this ever happened again. And as you can imagine, as an impressionable 14-year-old female, anything that would lead to an abdominal exam and a rectal exam was going to be swept quickly under the carpet. So although I continued to have many of these events, sometimes 10 or 12 in a day, especially around my period, I didn't talk to them or talk about them to anybody. I was afraid that I would be seen as, I just felt weird. I couldn't describe them. I actually called them weirds. And I didn't want anybody to know what was going on for whatever reason. So I learned to hide them. If I was sitting in class, I would dig my head a little further into the history book. If I was in the hall in between classes, I would step into my locker just a little bit further so no one would have to see. And life went on like that for about 4 years. When I was 18, I gave blood at my local high school blood drive. And after I gave blood, I had many more of these events that I called weirds that day. At the end of the day, I was walking out of the high school with my same girlfriends, and another one of these episodes started, but it didn't do the normal crescendo that I was used to. It just continued to get worse and worse. I tried to reach out to my friend to ask for help, and the next thing I remember, everything was black. I've been told that I had a generalized tonic-clonic seizure, and I woke up in the bed of the ambulance with a stranger's face hovering over me. He explained that I had a seizure and we were on our way to the hospital. The subsequent hospitalization and diagnostic tests revealed that my diagnosis of epilepsy. It was the first time that those events that I had had for years before were correctly diagnosed as actually focal seizures. I remember sitting in the neurologist office after I was diagnosed with epilepsy, or when I was diagnosed with epilepsy, and his diagnosis began with a list of things I couldn't do. You can't skydive, you can't drive for now, you probably can't ever be a pilot. You probably can't ever go scuba diving. And the list went on and on. Since that time, I've talked to a number of other people who've been diagnosed with epilepsy, beginning with a list of I can'ts. I remember stopping in the waiting room after we were there at that initial visit, and there were a million pamphlets, and I tried to pick up everything I could. Women with epilepsy, living with epilepsy, your seizure medications, and I grabbed them all because I wanted to understand this thing. But as we were walking out of the office that day, I also made a very, very firm decision that I would not let seizures define me. I was not going to let epilepsy alter who I was and who I wanted to become. So I took all the pamphlets, I crumpled them up, and I threw them away. I was placed on carbamazepine or Tegretol, and blissfully, the seizures slowly went away. In fact, for the first few years of college at the University of Wisconsin, I had no seizures, and I was doing quite well. As the stress level increased and my sleep deprivation increased towards the end of my college years, I again began to have a small cluster of seizures about once a month at the predictable time. I eventually decided it was time to establish care with an adult neurologist here in Madison. I remember visiting with him the first time, and he listened to my story, he took my history, and at the end, he sat back and he looked at me and he said, "Kristen, you're gonna think I'm crazy, but I think you need surgery." He explained that the febrile seizure I'd had so many years ago probably left a scar that was the cause of my seizures. And he explained that my best chance at seizure freedom was probably to have that area removed, and then I potentially would not have seizures anymore. By the time I visited him for the first time, I was a junior in college. I was scheduled to go to medical school within a year, and I didn't have time for seizures. I didn't have time for epilepsy, and I sure as heck didn't have time for epilepsy surgery. So instead, we elected to increase the carbamazepine, which for some wonderful reason made the seizures go away again for several years. In fact, I had very few seizures in the years in which I began medical school. I got married to my husband, and even the very beginning of my pediatrics residency. So I was a pediatric resident in the US before they passed the work hour restrictions for medical trainees. And I actually was working like 100 hours a week in the hospital, sleeping in the hospital every third night, woken up multiple times, sometimes staying awake for full nights in a row. As those of you who are familiar with epilepsy can probably guess, that sleep restriction and stress led to worsening of my seizures yet again. This time I went back to my neurologist and we elected to try a different medication, which caused some side effects. So we elected to try a different medication, which caused more side effects. And then we tried to try a third medication until finally I waved my white flag and surrendered. And it was time, I thought, to pursue that epilepsy surgery that we had talked about so long ago. So in May 2003, I had a right temporal lobectomy, which removed the right hippocampus. The pathology report was actually severely scarred and gliotic, or had a medical scar. And the surgery proceeded as planned. Everything went well, no complications. And I was back at work 6 weeks later. Again, I had hoped that I had left epilepsy behind, and I moved on with my life. 5 months later, the seizures returned. So life since about 2003 has been kind of a sine wave of the same things. I've had periods where seizures were well controlled. I've had periods where they were worse. I've tried new medications. I've gotten off those medications because they didn't work as well. I've had 3 pregnancies with 3 amazing children. And during each one of my pregnancies, I had generalized tonic-clonic or grand mal seizures. Somehow the kids have worked out to be perfect, but my husband ended up saying to me when I was pregnant with Callie, my daughter, he said, I don't call the ambulance anymore. I just hold on to you, watch the time, and hope that it goes away. So the other thing I noticed as I was living with epilepsy, especially as a young mom and as a young pediatrician, was that people were really uncomfortable talking about seizures. If I would mention to one of my pediatric colleagues that I had epilepsy, they'd say something kind of contrite, like, "Oh, but you have seizures, but you're on medication, so everything's fine, right?" Which of course it wasn't. Or even if I mentioned to a patient that I had epilepsy, they would change the subject really fast because they were really uncomfortable that their doctor had something that might make them not as competent. If I talked to my neighbor and I mentioned that I had seizures, they would kind of jump off that subject really quickly because it made them uncomfortable, or maybe they didn't know how to interact or react. So after my daughter was born, I began to write. I wrote about not only my history, but I wrote about the history of epilepsy. I wrote about how living with epilepsy and trying to preserve this kind of shroud of normalcy, or being able to be in the world we're constantly worrying about seizures, was really a challenge. It was difficult. I wrote about how living with epilepsy and how being with a patient had really impacted how I operated as a physician. I wrote about how little things that my doctors and my providers did for me, like sitting at the bedside for an extra minute or calling when they didn't have to, made all the difference in the world to me, and how those little things really could have been part of what helped me kind of buoy up and continue on as I had. I also wrote about how epilepsy was my constant agitator, but also something that had given me strength to keep going, to fight this, and to keep every day trying to get on top of the seizures, the side effects, and move forward so that I also might be able to show all of us that we can succeed despite seizures, despite medications. So my book was published in November 2015. And I spent the next year talking to community groups and to groups like yours about living with epilepsy and about how common epilepsy was and about how we need to talk about it more. And in that year, I had the opportunity to meet a lot of people who had been touched by epilepsy in various ways. I talked to a doctor who lived with epilepsy, but she was too afraid to tell her patients for fear of being judged. I talked to a lawyer who was living with epilepsy, but hadn't even shared it with his coworkers because he didn't want people to perceive him as not being capable. I talked to a mom who had a child with epilepsy, who was scared for her child at school every day, who felt like school wasn't providing the resources that were needed for her child who learned a little bit differently. And I talked to many people who weren't touched by epilepsy, who were like really, really surprised at how common it was and how hidden of an illness this was for a lot of people. And as I was talking to these groups, I realized, or I reflected, I thought there was one more thing that I could do, because it was nice to talk to people, but what if I had the opportunity to treat children that lived with seizures? So in 2017, I made the decision to go back to training to learn how to become a child neurologist so I could treat the very children who were in the shoes I was in 20, 30 years ago. I graduated from my neurology residency in June of last year, and it is the most meaningful and useful thing to me to interact with these children who are walking the shoes I've walked in. One thing I've made sure to do is when I deliver the diagnosis of epilepsy to a child or to a family, instead of beginning with that you can't conversation, I always begin with, these are the things that you can do, and this doesn't change who you are. And I'm hoping that that will make some difference in their life moving forward. So throughout the years, I've kind of worn three different hats, right? I've worn a hat as a patient, I've worn a hat as a pediatric provider, and now as a child neurology provider. And these different perspectives have kind of changed how I look at both living with epilepsy and how I provide care for patients living with epilepsy, and how I interact with family members and people in the community who are learning about epilepsy. I think first and foremost, the thing that I've learned along the way with all of the hats that I'm wearing is resilience. Being resilient sometimes is the thing that can help us the most. The one thing I've realized time and again is I am one of the lucky ones, right? I live with seizures, I've had brain surgery, but I'm still able to work, I'm still able to drive, and I'm able to be a mom. I know that's not the case for many of you, for many people living with epilepsy, and for many of the people that continue to have seizures and are treatment resistant. That being said, I think all of us have something to offer. And whether or not that means that as a person who's profoundly affected by seizures, just by reaching out to somebody else who's walked in the shoes you've walked in, by reaching out a hand, sometimes that lifts us up as well. What's given me resilience is being able to be a provider for those people who are living with seizures as well. Because by helping others, I feel like it's helping me too. One of my good friends and colleagues, an elderly woman who was a neurologist, just died of stage 4 breast cancer a couple of weeks ago. At her funeral, or actually at her visitation, her husband, who's also a pediatric neurologist, said one of the wisest things to me that I've thought about again and again. Ivy had been living with stage 4 breast cancer for 7 years. And he said, you know, Ivy never focused on what she had to deal with day to day. She always focused on other people, and then it helped her get through every day. I think about that a lot because, well, I feel like I could really, really be angry about my seizures and the fact that I'm probably going to have another surgery in 6 to 12 months. If I use that anger and that energy and help other people, it doesn't make me as focused on my frustrations. Another thing I've learned along the way is it's important to be an advocate. Whether you're a family member who is advocating for your family member with epilepsy, or if you're a patient who needs to advocate for yourself. Repeat yourself, ask for help when you need it, ask for the specific things that you need, or talk about the experiences that you're having that are troublesome to you. As a provider, I know that your physician, your providers care and they want to help you. But I think sometimes that gets lost in the mire and the craziness of the day. And so sometimes if you feel brushed aside, it's not an intentional brush aside, but it's because the busyness of the day has made everything wash out. So keep advocating for yourself or your family members. Keep repeating yourself. If you're having a side effect that's bothersome to you, don't accept, let's just keep trying. Excuse me. Keep asking for what you need, and eventually we'll get there. Also, step out of your comfort zone if you're comfortable. Sometimes, especially those of us that are living with chronic illness, we find what works for us and we stay in that box. But stepping outside, whether that means attending an Epilepsy Toronto meeting, or maybe even taking that further, like participating in one of you guys were just talking about fundraisers or ways you can educate the community. Things that aren't entirely comfortable for you are sometimes the things that could be the most meaningful to you and to others. I don't have to repeat this, you've heard it before, but taking medication is important for all of us. It's important for me. If I miss a dose, I tend to have a difficult night. For families that I've interacted with on the provider side, sometimes people don't understand why they need to take a medication every day for an event that happens once every few months. What's probably many of you know about epilepsy is the seizures are one symptom, but actually without medication, if you're having subclinical events seizures can beget seizures over time. So taking your medication regularly is really important for all of us. And finally, I think I've kind of alluded to this, but medication side effects are real, but sometimes they're hard for providers to understand. Gabapentin gave me nausea, but nausea is subjective sometimes, right? But I really couldn't even eat with the gabapentin. So I had to bring it up a couple times before we were switching off of that. Topamax or topiramate, one of the known side effects is cognitive slowing. But when you're tired and you're overwhelmed, are you really having cognitive slowing, or are you just tired and overwhelmed? I persistently brought it up until I got to the point in the dose level where I couldn't even do mental math in my head. Like 11 minus 7 was too hard for me. And that's when we finally switched off the medication. Keep bringing up side effects if they're real for you, but don't give up. If you've taken the medication for 6 days and you still feel tired, give it a little bit of time before you're ready to give up, because sometimes those will go away. Lastly, though, if the side effect is purely intolerable, I took oxcarbazepine once and I saw double, and I couldn't see or focus for the rest of the day, and I will never go back to that medication again. So you kind of develop what you can tolerate, what you're willing to live with, and then you just keep advocating for yourself until you get to the place you need to be. I've alluded to this, but if you guys take away one thing, what I'd really like all of us to remember as caregivers, as family members, or patients, or people that care about people with epilepsy, a diagnosis of epilepsy does not always mean that life is over as you know it. It's cliched, but I like to think about living with epilepsy as a way to open different windows instead of closing a whole bunch of doors. So I can't be a surgeon, but I can be a pediatrician. I can't be a race car driver, but I can be a mom. Children who are looking towards their life, if they have a diagnosis of epilepsy, or people living with ongoing seizures, might not be able to be professional baseball players, but maybe they could be teachers. Like, just different ways to think about the cards you've been dealt and how you can use that to help yourself and to help other people. But it doesn't mean that you have a list of I can'ts before you get a list of I can'ts. We should always start out with, this doesn't change you. It doesn't change who you are. We're going to think about where we can go with this and how we can make this something that we grow from and we learn from. One thing I often neglect to remember is that epilepsy is like a family member. So it's like Uncle Jimmy that comes to the holiday celebration that you really don't want to be there, but he's there all the time, or acknowledge that he's in the room. These are my 3 kids. I told you that I had seizures with each one of these pregnancies, but somehow they're perfect. So my kids are now 16, 14, and 11. And I like to think that I've kept epilepsy from them, but I actually often am reminded that I haven't, or it's impossible to. Seizures and seizure worry affect more than just me and my household. If my kids notice that I'm tired or I'm going to bed early, they will ask my husband, oh, does she have a seizure? Like, it's there. They're asking about it, but they usually don't ask me because I try to keep it from them, which is probably not the most effective way of dealing with things. When I was in the epilepsy monitoring unit last month, I only worry or learned that my kids were worried when I talked to my daughter's parents or my daughter's friend's parents. She was talking about my hospitalization at their house, but not at our own. So I think it's important to give our loved ones a space to talk about their questions, to talk about their fears, and to answer really honestly and appropriately kind of what's going on and what to expect and what we can't control and what we can control. Speaking of things we can control, teach your family members or loved ones how to respond to and how to manage a seizure. When my kids were young, the answer was call 911. My husband knows how to administer rescue medication if we need it. We've taught them basic seizure management, like to make sure that everybody's safe, there's no sharp objects. And if it applies to any one of you or any family members, if the person that you love or you have frequent seizures, you probably know that watching your clock and timing the seizure before you administer medication or call for help, if it's a routine event, that time is super helpful as well. Instagram has a lot of influencers, right? That you constantly are looking at, and it's changing how you're thinking about the world. I think about epilepsy as my influencer. Whenever I have a quiet moment and I am just kind of lost in thought, epilepsy always comes up. The horse is here on this slide because I wrote about epilepsy like the horses at the really, really pretty farm that's not too far from our house. So I used to go walking by this farm and I'd see the horses, they were hidden in the shadows, and they're actually kind of beautiful in the distance. Now, I don't mean epilepsy is beautiful, but I do mean that there are things that we can learn from it, right? Untamed, and a horse can be very powerful. It can be dangerous, it can be harmful, but if you give it the respect it needs, if you take the medications and seek care, then this thing that we're living with can kind of influence how we look at the world. For me, this has influenced how I am grateful that I am able to continue to work and be a mom. It's influenced how I am grateful for each day, for each new achievement or success, and how I'm grateful that I have the chance to talk to others or to interact with others who are going through a lot of the same stuff I am. I think it influences all of us in various ways. And while we can't control that epilepsy is a part of us, I think we can control how we look at it. We can consider it a curse, or we can consider it something that we can benefit from in a variety of ways. Not that it's anything that's beneficial to us, but we can view it in a way that will make us stronger. And that's how I choose to view my own epilepsy. So I've mentioned I'm a physician. I'm now practicing in neurology. And my own journey with epilepsy really has changed how I look at patients. From the neurologist standpoint, when we are treating a kid with epilepsy and we are trying to figure out if they have a surgical lesion, the child, you probably might be familiar with this, is in the hospital and the monitoring unit. We want to capture that seizure. We want to see where it comes from, and we want to see if it's addressable. But as a patient, I often have to step back and remember seizures really can hurt. They're uncomfortable. Sometimes your tongue is sore, your muscles are sore. It changes how I look at wanting to capture as many seizures as I can, or want to make sure that medication is working just so. And it also helps me be empathetic to patients that are going through all of this, because I know it's not easy, even if our end goal is the same, which is to treat the seizures. I've mentioned a couple times, medication side effects are real, but sometimes they're difficult to understand. So as a provider, this has helped me slow down, to listen closely, and to really, for those vague symptoms and vague things, it's helped me pay attention to what's going on. Empathy really matters. So during my first surgery back in 2003, the 3 things I can take away from that hospitalization that come really crystal clear in my mind. One, the night after I came back from the operating room, my husband was very upset because he doesn't like illness. And he was sitting at my bedside crying, and the nurse sat down next to him, held his hand, and explained everything. And that intervention, which took her very little effort, has made all the difference for both of us. When I was transitioning medications, the epilepsy pharmacist walked down the hall to find me at work and made sure I was doing okay. Took him 5 minutes, lasted me months of being willing to work with the medications. And even in the hospital, just working, the fact that somebody sat down in the rocking chair by my bedside and took a couple extra minutes to sit there really made all the difference. And your motto for Epilepsy Toronto is see the person. As a provider and as a patient, I think seeing the person beyond the illness is truly what can make a big difference for all of us. Finally, it's okay to be vulnerable. It's hard for all of us, right? But saying this hurts, this is uncomfortable, I need some help. Sometimes those are the things that get us the most benefit or get us the furthest in our care and in caring for others. Really quick about empathy. Epilepsy's unfortunately or fortunately taught me empathy, but actually they've studied empathy of physicians and or healthcare providers and how it impacts the care, and have proven that patients actually, like, from the common cold, get better faster if your physician is empathetic. They've proven that patients with diabetes have better control of their diabetes if their physician is empathetic. So hopefully, if I am an empathetic child neurologist, my patients will do better as well. So you guys have been really attentive. You're probably wondering, okay, so what can we do to make a difference? I think one of the big things we can all do, whether we're affected by epilepsy or we're touched by epilepsy in a different way, is we can talk about it. So a person that I trained with used to talk about epilepsy and the use of the word seizure disorder that a lot of us use. And he'd say, you know, if a person has cancer, we don't say they have a cancer disorder. Or if they had diabetes, we don't say they have a sugar disorder. We just call it what it is. If we dance around the word epilepsy, it makes the word kind of a little bit uncomfortable to people, right? So let's talk about it. Let's use the word epilepsy. Let's make people more comfortable with the conversations that I was trying to have with my coworkers years ago. So it doesn't turn people off or make people want to switch the subject. Because this is so prevalent, let's talk about it a little bit more. Other things we can do, you guys, I'm preaching to the choir, encourage your friends and family to get involved. I could give you a whole bunch of US organizations, but I don't think you need those. But in Toronto and Canada, you have a whole bunch of organizations that you can get involved in. And if it means more, or going to the meetings is the first step, but the board members, the family members, the people that are actively doing things and reaching out to the community, the more you can talk to people and educate them, I think the better it'll be for all of us. And finally, if I'm not running too long, years ago, I was asked to describe what it's like to live with epilepsy to people who don't live with epilepsy. So yeah, I wrote a poem trying to kind of put into words what I've experienced. And I thought I'd close by reading this to you and seeing if it rings true for a lot of you. So living with epilepsy means I know the distinctive scent of EEG glue as well as I know the scent of my own children. Living with epilepsy means that I've learned to fall asleep in MRI machines, wait patiently in doctor's offices, and perform neurologic tests without prompting. Living with epilepsy means that I must not be the epileptic patient, but rather the patient with epilepsy. I cannot let seizures own me. Living with epilepsy means that even some of my most significant days have been accompanied by seizures. The day I delivered my son, my 10th anniversary, Christmas Day, Thanksgiving. Living with epilepsy means that when the familiar sensations of a partial seizure appear, I find myself searching for a place to sit away from view in case the simple seizure leads to something more. Living with epilepsy means hiding my illness under a well-designed shroud, afraid that if others know that I have seizures, they will lose their faith and trust in me. Living with epilepsy means I examine my tongue each morning to look for the characteristic bites of the sign of a nocturnal seizure. Living with epilepsy means learning to ignore the staggering fatigue that comes with each new medication trial and medication adjustment. Living with epilepsy means that I can list almost every anti-seizure medication and its associated side effect profile. I have tried almost all of them. Living with epilepsy means that I treasure the mundane and hold these things as close as possible for fear of losing them. My driver's license, my health insurance, life insurance. Living with epilepsy means that I will consent to tests to turn off part of my brain, remain tethered to the wall for up to a week, and consent for removal of my entire temporal lobe in hopes of a cure that still eludes me. Living with epilepsy means that I've created a handful of euphemisms to describe a seizure: head problem, not right, episode, incident. Living with epilepsy means that I feel compelled to join others like me and look down the long, dark road that I pray may ultimately lead to a cure. And that's all I have. I'd love to answer any questions.
Well, I'm inspired. Let's take a deep breath. We've seen some comments that you've really resonated with people. people are going to the chat room, I think the easiest way is to, because we have so many people online, is if people have questions, please put them on the chat and I will endeavor to keep up and ask some of them. But maybe I'll start if that's okay. I really like that so much of what you said. I like your advice to people to be advocates and to talk and to share and to look for opportunities. It has been my experience that not everybody has a neurologist just like you, although we have so many wonderful neurologists in our community that we can be blessed by. When you don't, and you want to establish some kind of rapport, and it's on you to be persistent, and it's on you to somehow help that person to be the kind of caregiver that you want. How do you do that?
So let me give you an example that I had last week, and I'll see if this answers the question. So I had a child, one of my colleagues was out of town, and there was a 12-month-old child who was having seizures at home. And the mom wasn't able to really describe these events because they're hard to describe. And actually had described it to a colleague of mine who brought the child into the epilepsy monitoring unit, and we monitored her for 2 days. And during those 2 days, she didn't have an event, but she had a normal EEG. So she was sent home and said, oh, you're having breath holding spells. 3 days later, she had another event and the mom recorded it. And then called the clinic, called her pediatrics clinic, and then sent us a video via YouTube. And the video was enough to clearly diagnose her with seizures. And then she was started on medication and things got a little bit quicker. So the answer to your question is diversify who you're asking, continue to ask, and document. It took her 3 providers and that video to finally get to the place where we needed to be. But I was thinking about her as I was kind of preparing what to say to you guys, like, just keep repeating yourself. If you're not getting what you need, keep repeating yourself. That answer your question?
It does. I admire, it's not always easy to do, to be persistent and to make sure you're getting that time that you deserve, and make sure that you, and feeling like you don't, that you matter, that you can be persistent and take some time. Let's see if we got some questions that are not mine. Okay. Question from, let me just scroll up a tiny bit. Michael, he says, how long did it take for you to become comfortable with sharing your story publicly? Any advice for people struggling with advocacy in their daily lives?
So Michael, I'll answer your question honestly in 2 parts. So the first part is, it took me well, let's see. Callie was born when I was 35. It took me 35 years to be comfortable even writing the story. And writing that was like this catharsis, but then getting to that point where publication, and I was talking about it, like I was so scared to talk about it. And I still to this day am, because the second part of that answer is, so I wrote this book, I talked about epilepsy in the community, I talked about my story, and then I became a child neurology resident. And I honestly was really disappointed because I, walking in, and thought, well, now I'm going to be in this environment where everybody understands epilepsy. But neurologists pride themselves on their intelligence. And if you know the literature about epilepsy, the literature says, well, over time, there can be cognitive decline. And so with my now colleagues or then attendings, I was really, really afraid, and still am afraid, to talk about epilepsy because I was afraid that that would make me less competent. But now that I am probably going to have a very visible surgery in a year, I'm going to have to be honest about it again. So the long answer to your question is, it waxes and wanes. There's a long, long, long way to go. And perhaps the more we all talk about it and the more comfortable we are as a community about it, it'll get easier for all of us. But we still have a lot of room to go.
All right. Melanie wants to know where, first of all, where we can get you purchase your book. So it's an opportunity to do a plug, if you may.
Thank you. Amazon.com. It's on there now. The publisher went out of business, but it's still online.
Anita asks, do universities usually provide accommodation to students with epilepsy in your experience?
Yes. I have not asked for them. I probably should, but yes, they do. And I should know, I don't know Canadian law. In America, it's covered under the Americans with Disabilities Act. And you can very specifically request accommodations, whether that's less call or less overnight events or timing on tests or things like that. You probably have an equivalent in Canada, right?
We do. We do. Although I think just like talking to your doctor, talking to your teachers or anybody in authority takes a bit of courage and persistence, if I may. They're going quick now. Let me just scroll tiny back up. Tracy says, I'm curious what further surgeries you're looking at and perhaps what new surgery options may be coming up.
Oh, that's a really good question. So for me, I told you, I had the temporal lobectomy. My right hippocampus was a big scarred mess. But I also told you I had lots of seizures over a long period of time. So if you're familiar with the concept of kindling, the more your brain seizes, the more it learns to seize. So I probably have a focus somewhere else. So I'm mid workup. There's two possible surgeries. One is a resection because it looks like there's still some hippocampus or still some temporal lobe that's seizing versus the RNS if a resection won't be good enough. So I'll have some depth electrodes placed in a couple of months to figure out if there's a source to take it out or where to put the RNS leads. And that wasn't existing in 2003 when I had the first one.
Anita asks a simple question. Is epilepsy a disability?
Technically, yes. And then my next thing will be if it's a disability to you, it would be how you choose to view it. And some people are much luckier like me than others. But at least in American language, meaning the lawyerly language here, it's considered a disability.
Mm-hmm. John says, memory issues are often common. Did you experience this? And if so, what are some strategies that you employed to get through med school?
Super good question. So the memory issues I noticed mostly were post-surgical. And I noticed in medical school, I am not a good verbal learner. So if I sit in class and I listen, I can't walk away from you and explain exactly what I just heard. But especially after my surgery, if I write something down, or even if I'm in the patient room and I'm taking notes on the computer, I will remember it much better. Studying for my neurology boards, it was copious notes and copious repetition. So those are the things I've learned to overcome. But if I don't take notes, I won't necessarily retain it as well.
While I'm waiting for the next one, I'll say that we are starting a new program that will be out soon called Stream. That will be a evidence-based group program that will focus on memory strategies, among other things.
Fantastic. So writing for me works. It's really interesting.
Others? Got Al, you're going to have to complete that. He said, I'm wondering what your thoughts were on, I imagine, epilepsy.
My thoughts?
I
got lots of them. Gosh, I think I just told you them all. Can you specify for me?
No. Yeah, the E was not for epilepsy. It was for Epidiolex.
Yeah. So in the States, Epidiolex is approved for Lennox-Gastaut syndrome and SCN1A or Dravet syndrome. I've seen some kids benefit from that. I'm watching the chat too. I think that somebody earlier asked about CBD oil, which it feels a little bit more kind of gray to me. It hasn't been proven to benefit people with seizures like mine or less frequent seizures. But the Epidiolex has been proven to show people with Lennox-Gastaut or Dravet syndrome. So my thoughts are it can help some populations, but not everybody. I think a lot of people, at least here, tend to rush to CBD in lieu of traditional medications. And that I don't think is always the first best step.
Drawing on your experience, your professional experience, when this individual would like to know when to disclose that they have epilepsy to an employer?
That's a really good question and a really hard one. So depending on the types of seizures you have. So if you are concerned that would impact your work, or you would need to be absent from work, I would disclose it right away. Professionally, what I've always done is I've told my close coworkers in case I had a seizure at work, and I've told my boss, but beyond that, I don't talk about it at all because I don't want to be judged. But I had an experience when I was a pediatrician where I ended up telling my boss after I unexpectedly missed work because I had a generalized or grand mal seizure, and that didn't go as well because it was kind of like coming, a whole bunch of things were surprising and she didn't know how to interpret everything. So now I've been upfront, but I've also said, kind of like I said to you guys, this doesn't mean that I can't do my job just in case it comes up. This is what's there.
And just to put in our own plug, we also have 2 employment counselors on staff. If you haven't met them yet and you have questions about disclosures, they answer those questions every day. Interestingly, Kristen, it's not, we have found that the hospitals and the medical community is not always the most understanding of seizures. One would think that it's a natural, but not always been our experience.
That's true. It's so disappointing. I feel the same way.
Michael has another question. He has a friend who is a physician, recently had surgery, and wants to know more about your return to work experience the first time and plans for the upcoming time.
Thanks for the good luck. So the first time I took 6 weeks off, and I was back at work within 6 weeks, kind of on a modified schedule. I told you about those 100-hour work weeks. I wasn't sleeping in the hospital as a resident. I have asked for, when I have the next surgery, another 6 weeks, and then I thought I'd take it as it comes. So we'll see. Hopefully this won't be a craniotomy again, but it could be, so I'm not quite sure. But I thought I'd start there with a benchmark. And good luck to your friend.
You're brave. Nancy wants to know if you tried marijuana, and I can tell you here, you can say that freely, and it's
it's legal in Canada. So Nancy, I have this like self-described like OCD about, it's probably because I have epilepsy, about not totally being in control of my capacities. So I've never tried CBD or marijuana because I'm afraid that I wouldn't be able to interact in a way that I expected. That's no judgment on anybody, but that's my own little hang up.
Miriam is interested in your opinion, I guess, as a pediatrician, or personally and as a pediatrician. Should people who had epilepsy as children continue to watch out for seizures later in life, like in their teens?
So the short answer is yes, but the long answer is it depends on the type of seizures. So if you had like childhood absence seizures, often those remit and they're gone. But other types of epilepsy, like the type I have, are sometimes activated by hormones. So as a provider, when I have that question, I usually say things like, it might be time to just be a little bit more aware when they're going through puberty or something like that, or they're sleep deprived or they're drinking, those common triggers.
And I missed a question from Glenda. It said, how do you deal with the uncertainty of not knowing where you'll be or what you'll be doing when you have a seizure?
This is probably where my self-described OCD comes in. I try my hardest to control all variables, which of course is not perfect and doesn't work. So how I deal with it is however I can, which is by trying to be rigorous about the amount of sleep I get, trying to avoid triggers as much as I can, and taking my medications regularly. I also carry some extra rescue med and some extra Keppra because I can use it as I need to. But probably the thing that drives me the most crazy is that uncertainty. I'm not good with uncertainty. I think it probably drives all of us a little bit crazy, but you do what you can.
Thank you. Misha wants to know if you've tried the ketogenic diet or if there's any evidence to suggest it can reduce seizures.
Definitely can reduce seizures, especially in certain populations, like especially kids that have like metabolic disorders like GLUT1A or GLUT1 deficiency, and in other populations too. I've tried it twice for a year each. If I'm 100% honest with you, I was like crazy compliant for 6 months or more. In fact, I did some extra MCT oil the second time around. And I continued to have seizures, so then I lost my compliance and I wasn't that awesome. In my own experience, it wasn't helpful, but there's plenty of evidence to support that it does help at least 50% of patients. So if it's something you haven't tried and it's something within the ability to try, I'd encourage a trial if your neurologist recommends it. It's not easy. It's hard.
It's hard, and do it with your doctor, and do it with a really good dietitian support, because it'll make all the difference in the world. Maybe a few other questions. All right, if you're okay with the time.
Oh yeah, I actually don't even know what time it is. Yes, I'm fine.
After 7. No, I'm just kidding. Are you ever asked to speak to other neurologists? I like this question, to help them better understand things from an epilepsy patient's perspective.
Not yet. I would love to. Honestly, when I wrote that book, that was my target audience. I wanted neurologists to read that stupid thing so they knew what it was like outside of the office. But so I'm secretly hoping that that invitation will come sometime.
Oh,
Hasn't yet.
We'll keep that in mind.
Okay.
I think there would be a number of people who would be very receptive here in our community.
Sure.
Do we need this from Anita again, do we need a doctor's note for schools to provide accommodation?
Yes, often you do. In the States, often you do, but not always. It also depends on your school district and their resources. So it can't hurt. Sometimes it would help. If you don't have care with a doctor right now, or if like you're in between, then you can always request that from the school first.
I think that would be our experience. It doesn't hurt. I think that's a really good advice.
Uh-huh.
Hang on, I miss who this is from. This is from Katrine, who says, thank you so much for all of it. And at work, she wants to know, how do you decide who to share with and how much to share? I was excited about my recovery after my surgery, but unfortunately I felt some people treated me like I couldn't function afterwards, even though I can.
Katrina, I totally relate to this, completely relate to it. And how do I decide? I keep it close to people that would need to know in my immediate vicinity. So my office mate and my boss. Beyond that, I really don't talk about it because I'm afraid of precisely what you said, that the stigma or the association that people say. So yeah, I'm trying to think of a better answer than that, other than I keep it close and I don't bring it up. There's some people that are like, at lunch, oh yeah, I had a seizure last week. And I don't want that to be the first thing that people think about when they think of me as a coworker.
Having said that, I guess for some people, the more casual and matter of fact you become, the easier it is for people to react in kind.
You're probably exactly right. Yeah.
Have you ever had a seizure when you're with a patient?
Twice. Once I was leaning over a baby, listening to his heart, and I had a focal seizure, and I just stayed there listening until it was over. The other time I was at the computer taking a history as a primary care pediatrician, and I felt it coming, so I excused myself and then came back. That's going back to the uncertainty question. Those are the things I worry about. But usually I'm fortunate. I have enough warning that I can excuse myself or take off if I need to. Hopefully it'll stay that way.
Has that affected your relationship with your patient?
No. Actually, the baby, they didn't know. The other people, they didn't know, which is probably, again, like it might not be the most effective way to deal with it, but that was my way of dealing with it.
Nancy says, what is the advice for weaning off of long-term medication use? Medication like Tegretol can be difficult to wean.
So first of all, talk to your physician before you wean off anything. That being said, if you have been, and I'm speaking as a provider now in the child neurology world, if you're seizure-free for 2 years, depending on kind of all your risk factors, sometimes it's appropriate to wean, but sometimes would be, if you didn't have an underlying brain abnormality or an abnormal EEG. The wean, I would talk to your doctor and pharmacist, but often it's a gradual, slow wean. I can tell you personally, I've weaned off Tegretol while weaning up on something else, and I was fine. But that was, I think, it was a wean over 4 to 6 weeks. So it just depends.
Trina says she can really relate to how you've worked through your seizures, and I venture to say that echoes most of the people here listening to your response. I'm going to say, wow. On behalf of everyone, just wow. Your candor and your preparedness to be vulnerable, to be honest, is inspired. We are so honored by the time that you have given us today, and we reserve the right to call you back if but for an audience of neurologists, or once again for ourselves. We once you're part of our family, you're always part of our family. So
Thank
welcome
you.
to our family.
Thank you. And thanks for what you guys are doing, for advocating, for real. Makes a big difference.
And I think that sort of brings to close the evening. I'm supposed to give one last call out to say, remember the Purple Walk, and all of you guys who are our virtual Purple Walk. It's virtual, by the way, Kristen. So if you want to participate, you're more than welcome to.
Yeah.
And remember, we'll send you all links tomorrow for those of you who haven't had a chance to sign up. But it would be nice to have you all with us in full force. I guess on behalf of Daryl, our president, and Mackenzie and Jack, who organized all this, and all of the rest of you who took the time to share your evening with us, thank you so much, and good night.
Good night. Thank you.